Yogah Karmasu Kaushalam.
So I was talking about this slide and the last figure wherein you can see that a kind of rope is tied under the foot. And that is what I was trying to explain, that it helps in acting like a spring. It absorbs the shock and it helps in improving the push of the power push from the foot. So that is the role of plantar fascia, and with overloading, you could see the reddish area being shown. That is the area which typically gets inflamed whenever there is overstress or overloading onto the tissues by repeated activities. Right. So what we can do is, firstly, we ask the person, the sports person, to reduce the loading onto the foot as much as possible. And very likely this can be done by switching over or for going for cross training. For example, someone who is a runner, long distance runner, or a football player, or someone who is onto the field for a long period of time, he can move on to swimming for training. So swimming will take off the load, as well as you can continue on with the training part. You can move on to cycling. So that will cover a part of your training and will not make you lose a lot whenever you get into the activities. So unloading is very important. Firstly, it can be also done other ways by inserting the insoles. We have got silicone insoles available, which inserted into the shoes, it will help in absorbing the shock from the body whenever we are running, jumping, etc. Plus, there are very good variety of shoes which are available in the market having the air pockets in the sole, which when you strike onto the heel, in that case, that those air pockets will take up the load and will reduce the impact onto the foot. So these are the things which can be done to prevent, or whenever there is inflammation of the plantar fascia, to reduce the loading onto the plantar fascia. Apart from that, I am not going to discuss more on the rehabilitation part in terms of physiotherapy in OPD physiotherapy or in center physiotherapy, wherein we use ultrasounds or we use wax baths or we use laser, we use trans radial shock wave therapy, etc. to treat the plantar fasciitis. I will skip those part. I will just focus on what we can do on the field or what as a player someone needs to focus on to. So these things hopefully it's clear. In case of plantar fasciitis, unloading as much as possible. That is by switching over the training to the cross activity, or by inserting the silicone gel insoles, or by using good quality shoes which are having air pockets which can absorb the shock or load and prevent the shock stress onto the tissues. We can also we can perform self stretching for plantar fascia. So going back to the previous slide, if you see where it is attaching the figure, here you see the plantar fascia covers whole of the foot. So from the heel to the toes. So what we are doing, self stretching for plantar fascia. Here the person is helping in stretching the plantar fascia. We can do it ourselves. We can hold the heel and we can try to bend the toes upwards. Okay, extending the toes. So when we do that, we are stretching the plantar fascia, and this will help in relieving the fluid accumulation into the and will help in reducing the inflammation and relaxing the fascia. There are other things like also say something like trigger point therapy or dry needling, etc., which can be used in relieving the plantar fascia. These are certain exercises which we can focus on to whenever we are dealing with the plantar fascia. So we can stretch the plantar fascia by using all these activities. There are a lot many more which can be employed. These are few of them. Rolling the ball, I think many of you would have tried this, and this works very well. It helps unloading the fascia. It helps in reducing, taking away the stress from the fascia, and helps in recovery of the fascia very well. And I would suggest we can perform this not only when you have got inflammation in the fascia, otherwise even you can use this so that fascia are a kind of covering. So when covering the tissues, all the tissues are covered by fascia. So the fascia, if they are relaxed, they will help in better mobility. I think I had given one lecture, recorded lecture on stretching and fascia release. There I had mentioned about the facial release, and if you focus on facial release, that will definitely improve the movement, the mobility, and the force production also. So these are the few activities which can be taken up by the sports person to relieve the fascia or help in plantar fasciitis. Next is ankle sprain. Ankle sprain is very commonly seen in players like basketball players or football players or hockey players. There is where there is a lot of cutting, twisting activities on the field. Kabaddi, kho, all these activities, there are likely chances of ankle sprain whenever the landing is not proper, especially uh, say a basketball player is landing after a throw, after a basket, and he's landing on somebody's foot. So when that happens, his foot is not stable, and that will put him in an awkward situation leading to ankle sprain. And the best thing you can do about any sprain is the rest. Rest is very important, and there is no replacement for rest. Whenever there is any injury, rather I would say, for any injury, rest is very important, and rest in acute period. That is, whenever it gets injured, if you take rest in that acute period, that will help speed up the recovery process. Most of the times, the sports persons will try to neglect or ignore the injury. Oh, it's minor. It will come up. It will be okay. We'll be fine. And then they try to continue with the play. And whenever the tissue is weak, even minimal of the stress, which otherwise do not cause any problem, a minimal of stress on a weakened structure can aggravate the injury. And this very commonly happens, especially we have seen this happening in the lower level, grassroots level players, someone who plays at district level, someone who plays at state level, because they are always afraid of, oh, if we show off the injury, we will be out. They will not pick up. They will put us out of the team, and that fear makes them hide the injury. And with the injury, when the player gets onto the field, definitely the performance is impacted, performance is affected. And when the results are not good, the player himself, because of the results, will be out of the team. So it is very important for the players to understand that do not neglect the injury at any point, any part, be it a minimal, be it a smallest of the injury. Always take all the care to for the injury to recover. That is very important. And rest is one of the most important factor. I am again stressing on this fact because I know that lot many players avoid this. Rest does not mean that you have to sleep all the time. Rest means you don't have to put stress onto the tissues which are causing the trouble or which are causing the injury, which have caused the injury. So you have to take off all those loadings and you can be still active. So that is very important. And for any sprints, again, I'm saying rest is important. Apart from the rest, we can go for ice application, which again, all of you will be aware of and will be practicing whenever there is injury. Apply the ice immediately. That will help in reducing the inflammation, reducing the swelling, and will help in early recovery. Apart from that, we can also go for bracing, bandaging, taping, etc. Uh, this is one of the mechanism wherein we could see how the injury to the ligaments can happen to the ankle. The ankle ligament strain can take place in football. This is one of the example. We can use braces of this kind, wherein the person is mobile, is able to perform the activity, not the sporting activities at the highest level, but he can still be in training with less loading, which does not affect the injury. So we can use this. We can this is strap bandaging, which again I think everybody will be familiar with and will have performed at any point of your activity career. So this is again very much required. Compression will always help in reducing the swelling. So focus on the activities like compression, ice. You might have heard of price. Price is protection, rest, ice, compression, and elevation. So always focus on this. Wherever protection is required, the bracing, the taping, the bandaging will always give you protection. That is, it will prevent the forces onto the injured tissues to be affecting them. They will prevent the forces to affect the injured tissues, or they will control the forces. They will help in reducing the swelling, and they will assist early recovery. Now, these are some advanced level exercises for ankle. This would also work for the knee and the hip because it's all in one chain. I mean, we cannot put off one joint. Okay, we'll take care of ankle, then we'll see knee, and then we'll see hip. No, they are all one close kinetic chain. When I say close kinetic chain, is all the forces works with them in a same line, and that's why whatever happens at the ankle is going to affect the knee and is going to affect the hip, and vice versa. So advanced level proprioceptive and balance training exercises we call it, and we can use these activities. You can see bozu ball, you can see the rubber plate, and even without any support, single leg standing, twisting activities, turning activities, even the same set of exercises are used whenever you got other ligament injuries like say ACL injury or TCL injury in the knee also. So balanced proprioception is very important, and that will this kind of training which we use in recovery before going back into the sports. This kind of training will train your tissues to take up the load which come across onto the field game. So if you train this or if your rehabilitation is complete, your chances of re-injury are very minimal. If the rehabilitation is not complete, which often is a case, there are two parts. One is the pain is gone. Once the pain is gone, you are able to perform the activity. Everybody, even a patient feels, even a player feels, oh, there is no pain now. I am able to move. I am able to run. I am able to play. So I can resume the activity. No, that is just one part of the treatment that your injury has improved. It is not painful now. But if you want to put the stresses at the highest level, which you are going to do when you play, when you are going to play, those tissues are not ready for those stresses yet. So, though they have improved, the pain has gone, they need to be strengthened. They need to be strengthened to the level that they can absorb the stresses they are going to come across. And if it is done effectively before going into the field, the chances of re injury are always minimized. And therefore, rehabilitation or other advanced rehabilitation is very much important before getting back into the field, before getting back into the sporting activity. And this is very much important for all the sports person. And I will say there is something called principle of specificity. So when I say principle of specificity, once you are recovered, that is your pain has gone, you need to train specifically as per your requirement. So suppose someone is a batsman, then he will need to strengthen the tissues the way he is going to use in batting. If someone is a soccer player, he needs to use the tissues in the way he is going to play in the field. So that kind of training is will fall into the advanced rehabilitation stage, and once you complete that, then you will be very much sure that you are very less likely to re-injure with minimal forces. If the forces are maximum beyond the body limits, nobody can help. But otherwise, with the routine stresses, definitely there is going to be no issue. And we should always keep in mind that we always rehabilitate to the level which we are going to work on to before getting onto the field. Next is shin splint, and most of the runners, especially runners, hockey players, maybe even football players, will come across the shin splint condition. And this is something, a kind of alarm. Shin splint is definitely painful and it will hamper your activity. It's definitely going to hamper your performance, but it is not so severe a condition which it can turn into if not taken care of. मतलब ये आपको तकलीफ तो देगी, लेकिन अगर इसका ध्यान नहीं रखा गया तो आपकी तकलीफ बहुत ज्यादा बढ़ा देगी. I mean, you will be out of the field itself. And very often I have seen people coming with shin splint, they know this is shin splint, and then they still continue with the activity, and then they'll end up into stress fracture. Very ironically, I would say it's a funny tragedy. I say funny because those people know about this, and because it happens to them after all the knowledge, I will say it's tragedy. We have seen couple of orthopedic surgeons who are long distance runners. They run for fitness and all, and then they get into long distances, so maybe half marathon or full marathon. And being an orthopedic surgeon, everybody knows that they would have full knowledge of what is shin splint, how it can occur, and how to prevent everything. And once they are into the sports, they will know more about all these things more practically. And rather, they are the go-to person whenever anybody among the group gets the shin splint. And those orthopedic surgeons, I know a couple of them who have who have developed stress fractures not once but twice or thrice in this career. Means if they are running for 5 10 years, within those 5 10 years, they have sustained twice or thrice the stress fractures, and that is once we don't take care of shin splint and we continue with the stresses, definitely it will lead to stress fracture. And once you have stress fracture, it will kill your time. I mean, it's going to put you off the game. It's going to take couple of weeks, maybe 4 4 5 weeks, or maybe more than that, depending upon your injury. And so, shin splint is something which is an alarm, and always take care whenever you develop shin splint. Again, the principle over here is rest. Impact activity has to be avoided as much as possible, or rather, refrain from the impact activity at itself. You can definitely switch over to something like swimming, which is not going to put stress onto the shin directly. It's non-impact activity, non-weight bearing activity, or maybe even cycling will help. But impact activity has to be definitely avoided to get early recovery from shin splint. Something which very commonly affects the runners or anyone who uses hill landing. There are different patterns of running being exhibited, and you'll be aware of if you do not follow the correct pattern of activity, any activity, if you're not following the correct pattern of movement, you are not utilizing the body resources efficiently. And when we do not work efficiently, we are over consuming our energy resources and we are putting the body at risk. So you could see the first picture when wherein the landing is very much onto the hill, and this is somewhere this is a point wherein we are not taking advantage of the foot. Our foot is a segmented structure; it's a walled structure, and as I said, fascia, like fascia, we have got the ligaments into the foot, we have got the arches of the foot, and all these are very well designed to take up the load, to absorb the shock. So if we don't make use of the foot structure, as you can see, if we are directly landing onto the hill, we are bypassing the foot. And when we bypass the one of the most efficient shock absorption mechanism of the body, the impact is going to be very high, and it's directly going to be onto the tibia, it's going to be onto the knee, it's going to be onto the hip. And with this, there are great chances that person will develop shin splint. With after shin splint, if not taken good care, if the shin splint is not managed properly, it will definitely go to stress fracture. And there is nothing else you can do. I mean, you can take medications, you can take supplements, but the only thing which it requires is rest. So you can always change over the training. You will go on non-impact training, non-weight bearing training whenever you got these kind of issues, that is shin splint. And with stress fractures, still you can manage non-impact activities in stress fracture also. Non-weight bearing strengthening can be done to the extent which does not affect the. You about how to improve on this particular activity, that is hill strike. If you want to avoid hill strike, it's not that you will start striking the foot, the toes, and you will start running on the toes. No, you're striking the heel because you're. So whenever you are having poor running on the hip musculature, because when these muscles do not work efficiently, bone. So to correct this, you should always focus on the core and the hip musculature. Interestingly, I have seen in most of the people I come across, in most people who are not sports person, I would say, if I pick up say 50 people, out of the 50, I can challenge that 45 will not be recruiting the hip musculature rightly. 45 out of 50, if I'm if I'm taking a lecture for 50 students, I know that out of 50, maybe all 50, but not less than 45, I can claim that. And I have seen over period of years working with the students that most of the people who come to the college, they join the college, they have very poor hip musculature, poor core musculature, and gluteus maximus is the largest muscle of the lower limb, gluteus maximus, and it is one muscle which is very underutilized, very underutilized. And I will quote one runner, बड़ा मजा का बात हुई थी. The patient had an ankle pain only, the same patient, and then we worked on the rehabilitation, and then we focused on the hip musculature, and I advised him about the gluteus maximus activities, and she said, अरे ये मसल तो कभी फैटिक ही नहीं होता है. So I said, because it's not utilized, it will never go to fatigue. Which muscle will go to fatigue? Which is utilized when utilized beyond the limit. Gluteus maximus, because it's not utilized or underutilized, it doesn't go for fatigue. And therefore, our focus has to be on improving the core, the back, and the pattern of running pattern of movement. The other running pattern you say is striking the midfoot area and the 4 foot striker. So 4 foot striker, definitely all the sprinters will use the toe running. The long distance people will can go for 4 foot to midfoot running, because they have to cover long distance. Going on 4 foot for a long distance will not be feasible. They will be using running usually. So always focus on the pattern of activity to avoid shin splint, especially in the runners and jumpers, etc. How they land, how they impact the foot is important. That analysis is important. I'm continuously delivering a radio lecture. There might be questions from your side. I think we can keep the questions at last. You can note it down and I can get back to you. So as I said, treatment for shin splints, rest, icing the shin, anti-inflammatory painkillers, arch support for your shoe, range of motion exercise. That is, if your activity is curtailed, your range is not full, your flexibility is hampered, you need to work on that. Neoprene sleeve compression, elevation. So these things you need to, this will help in acute condition when you develop the shin splint. Otherwise, the advanced rehabilitation will definitely focus on your core and your hip musculature once you are out of the acute condition. That is when you have sustained the injury and you are recovering, when you feel the pain has subsided to a good extent that you can get back to the activity, then you will have to go for the advanced rehabilitation, what I mentioned, focusing on the core, focusing on the hip musculature. Coming to ligament injuries of the knee, so all the twisting, rotational activities, cutting activities would lead to ligament injuries of the knee. That is the ACL and PCL, which would be very much you will be aware of. ACL injuries are very common in footballers, very common in basketball players. Even we have seen kabaddi players getting the ACL injury. So any activity which involves cutting activity, pivoting activity, that is sudden rotational activities, all can develop the ACL or PCL injuries with high amount of forces. So what can be done for that is protection is something very important. You can use protection. That is, if you feel you are going to, you are say you are having some issues with the knee and you are continuing with the activity, you can go for protection. Or if you have injured ACL, then protection is must. Even when you are going for rehabilitation, uh, is it anything for me? Okay, fine. So I'm continuing. Hopefully that was a disturbance. So this kind of braces you will be you would have used maybe if you have injured the ligaments anytime. And strengthening is again a very important factor over here. This is in advanced stages. Whenever you go for rehabilitation, your focus will be again on strengthening the muscles, because stronger the muscles, less the load will be onto the ligaments comparatively, and they will help in absorbing the shock, and therefore the chances of injury will be minimal. Or in case of injury, once you have recovered, maybe you have been operated upon for the ACL or PCL injury, and again you are back to the rehabilitation, then you are going to use these kind of braces, the supports. And also we are going to go for those advanced rehabilitation, as I spoke about proprioceptive and balance activities, which you can perform on balance board, which you can perform on bosu ball, which you can perform at the advanced stage even on trampoline. Trampoline is even an Olympic sport, if you would have seen, and therefore those activities requires a lot of proprioceptive and balance activities. So all those activities can be taken up for the treatment purpose. Hamstring strain and tear. This is something very common. Very hamstring injury is very common to runners. Hamstring injury is very common to footballers, hockey players, cricketers, etc. So whenever when a muscle can strain or when a muscle can tear is when the muscle is not ready to perform the activity, or when the muscle is fatigued and then it's overloaded, or muscle is very weak. In any condition, the muscle can lead to strain or it can lead to tear. And again, this is something which you cannot control on the field. I mean, we cannot say that you don't do this and you won't injure your muscle or tear your muscle. This can occur whenever you are performing to the maximum level, or when your muscles are fatigued, or when your muscles are not ready to take up the load, or they are very weak. And when I speak about hamstring strain, I very fondly remember the last race of Usain Bolt. If you remember the last race of Usain Bolt, the 4 into 100 meters relay, in which Usain Bolt sustained hamstring strain. If the video plays, I just got the photograph. Yeah. So I just got this shot, and this is from the last race of Usain Bolt, wherein he limped off after taking the baton half away. He started limping because of the hamstring strain. And it is important to know why did it occur. I mean, why to Usain Bolt? Why Usain Bolt developed hamstring strain? The person who has been playing since 4 Olympics, and he's been winning medals. He's a sure shot person. Oh, Usain Bolt is there. He's going to take the gold. How did he develop this injury? So the clarification which I had come across for this, which I read into the articles and which I heard into the YouTube from the interviews of Usain Bolt, it said that before the 4 into 100 meters relay, there was a race, I think 5,000-meter race, and that was the last race of Mohammad Farah. Mohammad Farah is a British Olympian, and because he also won a gold in marathon, I think for not marathon, 5 or 10,000 meters for Britain, and therefore he was a celebrity in Britain. And because this championship was being held in London, after completing the event, Mohammad Farah was taking a victory lap around the stadium. So he took lot of time. He consumed lot of time in that celebration, and we know about warm up, right? We all go for warm up before the activity, before the event. So this team of 4 into 100 meters, everybody was trying to warm up, and because everything is very much timed. You know when your event is going to start, when you have to perform warm up, when you have to stop warm up, how much time you are going to spend between the warm up and between the activity. Everything is calculated, and it has to be. So And because it was in London, and London is a comparatively very cold city. The temperature over there is quite low. So Usain Bolt and the team had to perform repeated warm-ups before getting onto the track. Because Mohammad Farah consumed a lot of time onto the field, their event was delayed, and because of that, they had to undergo repeated warm-ups. They would warm up, they would wait, and then by the time they would cool down. So again, they had to warm up, and this had happened for 3 to 4 times, I think. And because of those limited warm-up attempts, I think Usain Bolt had some issues with repeat. I mean, he had put in a lot of efforts in those activities, and because of that, he developed hamstring strain. So the best way over here is to train the tissues to the maximum level, to time your warm up, to control the activity intensity before you get onto the field, so that these kind of things does not happen. Even dehydration can lead to muscle strain or injury or cramps, anything. So all those nutritional factors also needs to be taken into consideration. Then is coming to tennis elbow. A tennis elbow, as it said, is commonly in tennis, seen in tennis, but not only in tennis. Sachin Tendulkar also had tennis elbow. So anyone who has to perform repeated wrist extension activity can come across tennis elbow. Even housewives who have to perform repeated wrist extension activities develops tennis elbow. So these are a kind of repetitive micro traumas. When do someone develop tennis elbow? Tennis elbows are usually not a traumatic kind of injury that he forcefully performed something and the extensor tendons of the wrist got inflamed or injured or tear. No, these are repetitive microtraumas. So whenever any activity is being performed repetitively for a longer period of time, they are going to cause impact onto the tissues. And those repetitive microtraumas, I say microtraumas because those are not real traumas which can cause injuries. Those are very minimal stresses. But those minimal stresses, when performed over a very long period of time, very frequently, very repetitively, it can lead to injury of these tissues. And that's why I say it's a repetitive strain or repetitive injury, repetitive traumatic injury. And tennis elbow can be dealt more effective, even golfer's elbow for that aspect. Golfer's elbow will involve more of the flexion activity, that is wrist flexion activity, as if you can imagine uh, the strike in the golf, you will have a wrist flexion, whereas if you imagine the backhand in the tennis, you have got wrist extension. So tennis elbow and golfer's elbow are kind of similar mechanism of injury. Both have same type of mechanism of injury, and this can be dealt again with bracing, again can be dealt with tapping. You could see the tapping, you might be aware of the kinesio tapping, you might be aware of rigid tapping. So there are different type of tapping, there are different type of braces available so as to control the, all these are basically to reduce the load onto the injured tissue. So when you tap, you are reducing the load onto the injured tissue. Okay. So those injured tissues are protected by tapping, by bracing, and you can continue with activities which are pain free. Again, the focus would be once you are out of the acute phase, the focus has to be again on strengthening. Any muscle injury, once you are out of the acute phase, will require a strong strengthening. I mean, you will require to be strengthen those muscles at the maximum level so that you get the maximum output in the events. Elbow to shoulder. Shoulder injury, very common in sports, especially rotator cuff, tendon tear, labral tear, shoulder instability, bursitis, biceps tendinitis. All these kind of activities are very commonly seen in all the players who are involved in the upper limb activity. For example, a bowler, someone like Jawagul Srinath had undergone shoulder surgery. Someone like a volleyball player, someone like a basketball player, or maybe if you know Mana Patil, the first female Olympian to qualify for the Olympic swimming, and she also had a labral tear. And because she is from Gujarat, we know that she was under training, and there were high training stresses which led to labral tear, and then she had to undergo a very long rehabilitation period. So swimmers are very much prone to shoulder injury, rotator cuff injury especially. All upper limb activity players are very much prone to shoulder injury. Okay, so the serves in tennis is again involves overhead activity, and they are also prone to the shoulder injuries. Swimmers are very much vulnerable because they use lot of hand activities. So again, the shoulder is very vulnerable for swimmers. The treatment again, once you are out of the acute phase, maybe if it requires surgery or it requires rest and conservative management. After that, once you are into the, or if it is a minimal injury, then the tapping as shown over here can be done to allow the player to resume the activity under controlled or under controlled stresses, so that they are still into the game. I mean, they are not totally off the training. So we can use tapping, we can use braces. This is especially when there is shoulder instability or there is a dislocation of the shoulder. In the injury, dislocations are very commonly traumatic dislocations. And again, the principle over here is price. As I said, protection, rest, ice compression, and elevation. I spoke to you about price. There is something more than price. There is mice. So instead of protection, there is movement. As I said, rest doesn't mean absolute rest. It doesn't mean that you have to lie down. Rest means you are not going to put stress onto the injured tissue. You are not going to load the tissues which are injured so that they can recuperate. You are going to give them an healing environment. Very, very well said in a book. Healing is a natural phenomenon. I mean, nobody heals you. Doctor doesn't heal you. We as a physiotherapist don't heal you. Healing is a natural phenomenon. What we do is we facilitate healing. We help you so that the healing occurs little faster, little earlier. So healing is a natural phenomenon, and what it requires is the conducive environment to heal. And I'm stressing this point because all the sports person should know that healing will occur by itself only if we give the right environment. And the right environment, it is in your hand to provide the right environment for the injured tissues so that they can heal very effectively and very quickly. Everybody wants a quick healing, but giving the right environment, I think, is not possible by everyone. Or they neglect, they don't take care of, or they just let it go, or they have to perform. We know one 13 or 14-year-old judo player came to us, and he said, "Oh, injured my back, and I am being selected for the nationals. So I have got pretty good chances of getting a medal at nationals if I play. But with this injury, I am not able to perform." And then we treated the player, and the player improved well. And though he was not 100%, he went back. He played the nationals. He won a silver, and he came back for the treatment again to us after the tournament. And he said that while playing the semi-final, he got injured, and in the final, he was troubled a lot by the back, and therefore he could not perform better in the final, and he had to contend with the silver. So it is very much important that we provide conducive environment for healing. Healing is natural. We need to provide the environment that is in our hand. So at times it requires protection. At times it requires control movement. When I say movement, movement is not that you are allowed to perform anything and everything. Control movement, control in a way that you don't stress the injured tissue. Coming to the second point, prevention of injuries. So, prevention of injuries is, rather, I will say, is the most important thing all the players should always focus on. Once you are injured, nothing is in your hand. आप कुछ नहीं कर सकते. इंजरी हो गई आपको फिर उसके कॉन्सिक्वेंसेस जो भी है भुगतने पड़ेंगे. मे बी you might be out of the game, maybe your career might be jeopardized. because of the injury, or maybe you are dropped out of the team, anything, you cannot do anything. So what we can do best is we can take care that we don't get injured. And how that is done, I'll just read out for you to understand. An exercise plan to strengthen areas that are impacted by sports or injury. So firstly, we know that which muscles in particular sports are more loaded. So we would identify those group of muscles. We'll focus on strengthening those group of muscles. We will work on the pattern of activities. We will work on the mechanism of movement, because strengthening is not everything. I mean, you might be strengthening, but isolated strengthening is different thing. Working in a functional pattern of movement. Functional pattern of movement is the pattern of movement which you are going to use in your sports. The way you are going to throw a ball, you need to train that way. How you are going to throw a ball, which muscles are going to work in that. So we'll focus those muscles, we'll strengthen those muscles, and we'll make you work in the correct pattern of movement and with the correct biomechanics, so that you don't get injured again. So one thing is that training for a specific sport will require you to use the same muscles, and repetitive strain can cause muscle imbalances leading to injuries. That is what I explained. And muscle imbalance, it was a study was performed on baseball pitchers, and it was seen that they have got a good external rotation range, but they have got restricted comparatively internal rotation range of the shoulder, because there was lot of overuse of the shoulder external rotation. Baseball pitchers जो ball फेंकते हैं baseball में, वो हाथ पीछे ले जाके they take the hand back and then they throw the ball forcefully. You would have seen baseball is not very common in India, so everybody might not have an interest and might not have viewed. But it's something similar to a throw in a cricket. So, and it was seen that their particular muscles are very strong and other part is weak. And body, there is a principle of biotensegrity. To simplify it, I will say it's a kind of structure wherein if one part is weak, it is going to affect the other part. If one part is tight, it is going to affect the other part. If one part is overstretched, it is going to affect the other part, the counterpart. For quadriceps is weak, the hamstring is going to be affected. If the hamstring is tight, the performance of quadriceps is going to be affected. So, if you want to improve the overall performance, we need to work on all the structures. We need to work on flexibility. We need to work on mobility. We need to work on all the group of muscles which you are going to utilize, and opposite group of muscles also. So that will help you in preventing muscle imbalances. Because usually what happens is, as I said, we'll focus on the muscles which are repeatedly used. So maybe for a lifter, the lifter will think, weightlifter, I require strong quadriceps, I require strong hip extensors, I require strong plantar flexors, but they would have strong plantar extensors if their counterpart, the opposite group of muscles, are strong enough. If they are weak or if they are tight, these muscles cannot be very strong or cannot perform optimally at its peak. So muscle imbalance definitely needs to be corrected and focus on to. It can be done by strengthening muscles that are underused or those are weak. And physiotherapy allows athletes to perform to the best of their ability and speed up recovery for the athletes. So the goal is to help you perform to your maximum level. That is what is required. Everybody wants that. We want gold medals. We want medals in Olympics, and that will come only when we can perform to our best. We can give our best, or the world best we can give. Then only we can get those medals. So our aim is to help the player put in their maximum, get them give their best, and if there is injury, we work on the rehabilitation so that the injury time, recovery time is reduced as much as possible. One thing, we can help reduce the injury time, but it's not a miracle. I mean, if a tissue by default say requires about 4 weeks of time to heal, we cannot make it 1 week. If we work, maybe from 4 weeks we can come down to 3 weeks. We can work little more and little more aggressively, little more vigorously in the advanced rehabilitation phase, so that you can get back to your sports more quickly if you get the required strength. So, but we cannot cut down drastically because, as I said, healing is natural. We can support, we can facilitate early healing, faster healing. We cannot heal by itself all out. So, this needs to be kept in mind. Interestingly, earlier, because in if we remember, we had people who had big values and they were still playing in the national team. And even they were performing. It's not that they were there because they could not perform. They were performing and still they were there. But they were not physically fit. When I say physically fit, I don't say they cannot perform, but they are not able to perform at the maximum level. And if you would have heard of when the team was being picked up, T20 team was being picked up for the matches against England in India. I think in February or March when England was touring India. At that time, Rahul Chahar, who is being picked up for the T20 World Cup yesterday, was dropped because he could not complete the fitness testing. Earlier, the fitness protocols were not strictly employed by the BCCI. Now they have very strict rules, and they follow by the rules. They go by the rules. Like if you cannot clear the yo-yo test, 17 is to 1, or I think they have gone down to 16 is to 1. If you cannot perform, sorry, they have moved to 17 is to 1. If you cannot perform the yo-yo test to that level, we will not pick you up, however better player you are. And that was done to, I think, couple of players. One was Varun Chakravarti or something, and another was this Rahul Chahar, and both were not being picked up, although they were a very good player and they were a strong contender for the team. So they have introduced fitness tests like yo-yo test, and there are for fast bowlers they have introduced like a fast bowler should perform 2 kilometers of running within 8 minutes. A spin bowler should finish 2 kilometers of running within 8.5 minutes. So these are the stricter norms which they have got into the selection criteria because a fittest player can only give the maximum. An unfit player, I don't say unfit means they are injured, but the one who cannot perform to the maximum cannot give the best. And therefore, these rules, this fitness test needs to be followed very strictly, and they have been doing it now. Coming to the last part, performance enhancement. Now, this is something very tricky. I mean, you might be thinking how this can be done, how a physiotherapist can help in enhancing the performance. And performance enhancement, everybody wants to improve, everybody wants to perform the best. And when they can do that, because when you go to the highest level, suppose you pick up a sprinter or you pick up a swimmer, what do they need to improve on to? They are going to improve on to say microseconds. Suppose for example Usain Bolt ran 9.59. What he wants, or anybody, what they want to go to 9.58 to break the world record. If you remember Mike Powell, whose world record in long jump is still standing 8.95 meter, still unbroken. What someone wants, who can jump 8.90, just want 5 centimeter more. If you, how do you say 5 centimeter? I mean, if you ask a layman, 5 centimeter, oh, just 5 centimeter. But for them, 5 centimeter is something very important. You ask a swimmer, wherein their selection is based on time trial, and they miss the selection by maybe hundredth of a second, or maybe PT Usha missed the bronze medal by hundredth of a second. So how can we cover this? It's not that you could not achieve the hundredth of a second, that was your failure because you could not achieve it. No, maybe a minimal of correction anywhere into your movement, anywhere into your activity can help you get this deficit. For example, if we pick up a swimmer, say, and a swimmer is a very good swimmer, and he got a silver maybe in the Olympics, he missed the gold medal just by a whisker. He wants to improve a little bit more. So what the therapist will do? Now there are performance specialists also, which works on this specific aspect. So they will have to study very keenly the movement patterns, the activities of the player. So they will examine how do they perform, what are the real or actual way, how are they performing, because it's not that the one who gets the gold or one who makes the world record is perfect everywhere every time. They might have some flaws somewhere, but because they are able to perform the best, they are winning. So if you want to improve a little bit, we need to correct those flaws. If some swimmer is taking a turn, if he's weak in turn, आप उसका turn थोड़ा सा improve कर दो, he will save maybe a second or maybe half a second, and half a second is too big a thing in swimming. You are missing bronze by hundredths of a second. So if you improve half a second by improving your turn, or if you improve half a second by improving your dive, you are going to get the medal. And that is wherein the performance specialist will come into action. They will observe, they will analyze the movements, they will see where what is going little out of the way. I don't say wrong, but if a minimal correction is given, the performance can be achieved. Long back, I was supposed to deliver a lecture in a workshop on shoulder. That was about the sports injuries only, and I was speaking about Jasprit Bumrah. Jasprit Bumrah was a budding bowler that time. Now he's a established bowler. But a couple of years back, he was seen as a very good promise. He was seen as a very good uh, pick of the India. So that time I was discussing, because Jasprit Bumrah has a very short run up. He's a very fast. He's a fast bowler. He's a genuine fast bowler, but his run up is very short comparative to the fast bowlers. And more than half of the force in fast bowling comes from your run up. You are gaining momentum. So most of the force, or more than half of the momentum, you are going to gain by running. If you have got reduced run up, you are going to lose that part. You are going to lose that momentum because you are not getting enough momentum. So how are you going to cover up that? And we are talking about the Jasprit Bumrah uses lot of the shoulder and the back muscles to generate the force, the power with which he bowls. He bowls excellently. He was bowling excellently, and then we were discussing, and my opinion was, because Jasprit Bumrah's bowling pattern is little a little different from what it should be actually, there are likely chances that he might injure the back, because there is a lot of forces onto the back which can be prevented by increasing a run up by a step or two, or by some other methods. So we are apprehensive that he might develop with a back injury. And just couple of weeks after that, Jasprit Bumrah was back from England, I think, with a back injury. He's from Ahmedabad, and he was back into Ahmedabad with one of the orthopedic surgeons who works into sports injuries, and he shared a photograph of his with Jasprit Bumrah, and we came to know Jasprit Bumrah has developed stress fracture at the back. So identifying the movement patterns which can cause injury, or identifying the movement patterns by correcting which your performance can be enhanced, improved, is very much important. And that is very well done by the performance enhancement specialists, by the physiotherapists, more specifically by the movement experts, movement analysis experts. And we do that. We work with the players, we work with the swimmers, we are working with the runners, we are working with the judo players. Fortunately, Gujarat government has come up with Khel Mahakumbh, and because of Khel Mahakumbh, there are a lot of young generations getting into the sports, and being into the sports injuries part and parcel of the sports. And we see a lot of the students, a lot of the players at a young age who come turns to up with the injury. And I will, if you are a coach, maybe many of you might be guiding the players. If you are a coach, what a coach wants: performance. And at the grassroots level, the focus is not a lot more on the technique, on to the pattern of movements. The focus is solely on performance. You have to get this timing, you have to get these points. That is it. How? No matter. No, at young age, the focus has to be on the movement pattern, has to be onto the flexibility, has to be on the agility, all those factors which can make a better player. And because this is not there, I don't say everywhere because I haven't seen lot many, but uh, we do visit couple of academies, and almost everywhere what we see is every parent is very enthusiastic about their children. Oh, my boy or my girl should be a very good player. They should become something like Sachin Tendulkar, or if they should become something like PV Sindhu, and they get their children there. And if the focus is not on those basic aspects, they will land up with the injury. That happens, and because of that, lot of budding talents dies off before getting into the field actually. I mean, at the competitive level, at the state or at the national level, because they get injured. The parents are also apprehensive. Oh, my child got injured. This is a risky sport. Avoid this. Leave it. And therefore, we lose lot of talents at the grassroots level. People often say India is a country of 100 billion people, and still we cannot produce enough medalists at the Olympics. I think it's not the lack of talent, it's the nurturing of the talent which is not possible or which is not taking place perfectly, which should be done so as to gain the medals. And I think the focus should be on that. So, if this video plays, it will not play. This is a video of us swimming. The academy I used to visit, and I had recorded this video to show off. And I could figure it out that how the players, you could very clearly demarcate the change in the movement pattern of the players, and which can lead to injury or correcting, which can improve the performance. So that is what I think we should focus on to injury prevention and performance enhancement. And I think I have done justice to the topic given to me by UGC and UGC HRDC and the team sports physical education department of the Gujarat University. I am thankful to all of you for this opportunity.